Today, I wanted to speak to the importance of understanding how a plant based diet can help with some specific healthcare chronic diseases. Healthcare for chronic diseases like heart disease, high cholesterol, um, diabetes, things like that. So, we'll get to some specifics here in a moment. But if you're new to the channel, I'm Dr. Lori Marvis. I'm a board certified family medicine physician and lifestyle medicine physician, meaning that I have training and certifications and understanding how to help people engage in healthy behaviors that can reverse and halt chronic disease, and amongst other things. So let's get right to it. Let me pull up my notes here. Okay, so first of all, as many of you know, switching to a plant based diet is packed with fruits, veggies, whole grains, legumes, and nuts. And it has definitely been getting a lot of attention for its ability to manage and even reverse chronic health issues like the diabetes, heart disease, high blood pressure. I've seen literally thousands of plant based patients over the last 12 years that I've been plant based myself and seeing patients on a regular basis. So not only does the science support this, but my own clinical practice absolutely holds that true. So we're going to talk a little bit about some of my own experience with patients, but we'll talk a little bit about the science for each first. First, we'll talk about the science. There we go. Next, let's talk about diabetes and plant-based diets. I think this is honestly some of the more really fun patients to work with because you'll see such an incredible improvement in your blood sugar numbers very, very quickly when you really start embracing a whole food plant-based diet. So remember, type 2 diabetes is one of the most common chronic diseases in the world and can be managed and, like I said, even reversed in some cases with that whole food plant-based diet. And research shows that eating more plant foods can improve your blood sugar, glucose control, right? Your glucose control, lower insulin resistance, and like I said, lead to remission. So let's talk about blood sugar control. So plant-based diets are typically lower in what we call refined carbohydrates and higher in fiber. So what are refined carbohydrates? These can be things like your bagels and your donuts, things like that. They're grains that have been ground up into flour and baked with added other oils and sugars and other things that are not good for you. Those are not, they may be vegan, but they're not healthy. When we talk about whole plant foods, that's the closest as they can come from nature as possible. That's what we're speaking about. So these also be higher in fiber. So what's happening with your blood sugar control? These things slow the absorption of sugar into your bloodstream. So studies reveal that for people following a whole food plant-based diet, they have significantly lower A1C levels, which is a marker for long-term blood sugar control, compared to standard diets. And a few tricks of the trade is, especially if you're on insulin and certain oral hypoglycemic medications, you want to be very careful when you approach changing in your diet, because when I first understood the power of a plant-based diet with type 2 diabetes with someone who had insulin was within the first year that I started utilizing this with my patients. And within 72 hours of someone fully embracing a whole food plant-based diet, I had to stop 60 units of insulin in 3 days. It blew my mind, and I was hooked ever since then. Working with diabetes patients is actually the majority of my patients has some form of insulin resistance. We have insulin resistance, prediabetes, full-on type 2 diabetes. Some are insulin dependent, some are not. I have type 1.5 diabetes patients I take care of, and type 1 diabetic patients. So everybody benefits as far as looking at your blood sugar control. Next, let's talk about the insulin resistance, right? So the fiber in plants helps improve your insulin sensitivity. One study found that people with type 2 diabetes who followed a whole food plant-based diet had better blood sugar control and reduced insulin resistance compared to those who ate traditional diabetic diets. So why is that occurring? Well, first of all, let's get back down to understanding the root cause of insulin resistance, right? So typically this is coming from the saturated fats that we absorb when we're eating ultra-processed meals, plant or animal products. And certain oils like coconut oil are very high in saturated fats. You want to be very mindful too if you still incorporate oil into your diet. So these things will cause basically the insulin not to work as well. So I'm going to make this very simplified. And so let's say you have a cell, and with someone who is not a diabetic, they eat, the carbohydrates are breaking down, and you have your glucose, it enters into the bloodstream. Now the glucose is taken up by cells and utilized for energy. The glucose cannot enter the cell until you have insulin, which is like a key that opens the door, okay? Now, let's say that you have some form of insulin resistance, pre-diabetes, type 2 diabetes, just some form where we describe that your body does not respond to insulin as well. What's happening here is that you can imagine if you have a key called insulin and it's trying to enter the keyhole, right, which is maybe, let's talk about the insulin receptor in the actual cell, what's happening in that membrane. Imagine if you had some chewing gum and you stuck that in the keyhole. Now the insulin's not going to work as well. The other way I like to do this is, when I was a kid, my mom would keep those coffee cans and she'd put the drippings from the fried like chicken and bacon, and they'd reuse it, but it's like basically lard and it hardens. Anyway, so imagine that stuff stuck into your keyhole. Well, the key is not going to work as well, right? So think of that as the saturated fats. It's not making, there's a whole mechanism behind this, but like I said, I'm making this very simplified. Now you have a keyhole that's full of gunk. You eat something, it breaks down to glucose. Well, the insulin tries to work. It doesn't work as well. So the body's like, why is the blood sugar still high? It pumps out more insulin. So now you have this hyperinsulinemic state, which is a very serious condition, because now when you have hyperinsulin, there's a lot of things that the body responds to in this elevated insulin state. One of them is you're going to have a harder time losing weight. So now we have more insulin being produced. The body is trying to make it work. Man, it just makes more. And over time, the body cannot make enough insulin to combat the insulin resistance, right? So then you start seeing blood sugars increasing. You start seeing the sequelae of having elevated blood sugars, and things start falling apart. And your doctor's like, Ann, you need some oral medications. Then you need a little bit more oral medications, and then you need insulin, right? So they're just trying to manage the number, but they never discuss the root cause. When you enter into a whole food plant-based diet and the state of insulin resistance, the body's like, oh my God, thank you. Finally, you're stepping out of the way. And we start eating all these amazing nutrients that are anti-inflammatory. They're not going to cause such a huge spike in your blood sugars. And before you know it, the body is cleared out. It's low in saturated fats. The body is clearing out all the damage that you've done. Now, in some individuals, you may still require some medications, because part of that type 2 diabetes, when you get diagnosed with type 2 diabetes, you've lost approximately about 50% of your pancreas ability to make insulin, right? So those poor beta cells are dead and gone. And when you start eating the whole food plant-based diet, though, hopefully you'll be able to fully reverse it, but at least hopefully get off the insulin, and certainly decrease the amount of medication that you're on. I had one patient who had an A1C go from 11 to a 6 in 90 days. And if that was a medication, I'd be a billionaire. And so that's the really important thing to hear, is understand that you'll see rapid changes. So speak to your doctor about this, because if I have someone who's on a large dose of insulin, I will many times cut the dose in half. And if it's on the lower end, I may just stop it altogether, because I don't want someone to go into where the point is that they become medicated, over medicated, and that lowers their blood sugar to a point that it's life threatening. So this is no game, guys. This is no joke. You got to really understand that the plant-based diet, when it comes to insulin resistance, is very, very powerful. And I've seen it over and over and over again. So if you approach it with the plant-based diet, just be careful with certain medications. All right, now let's jump over to heart disease and plant-based diet. So heart disease, remember, is the leading cause of death around the globe in men and women, right? So, but a plant-based diet can absolutely reduce the risk factors and even reverse disease progression. I know there's some controversy in that, but we're not going to dive into that. But let's just talk about what I've seen and what some of the studies show. So cholesterol and blood pressure. Okay. A plant-based diet, absolutely, one, again, is lower in saturated fats and cholesterol, can lower LDL cholesterol, the bad cholesterol, and certainly improve your health. Research shows that on plant-based diet, they tend to have lower rates of high cholesterol and blood pressure. When I switch someone I mean, I'll highlight some of the cases that I've seen. Patients, the first time again that I remember the cholesterol dropping 120 points in 30 days. I've seen patients drop so low that we have to actually can pull back on the statins. Now, granted, this depends on if their medical history, they may still require some statins, depending on if you have coronary artery disease. Again, lots of things to consider here on if you should or should not stop medications. What is your history? What is your current state of health? Lots of things to describe here. When it comes to reversing heart disease, there was Dr. Dean Ornish study that certainly found that a plant-based diet combined with certain lifestyle changes could not only prevent but also reverse coronary artery disease. They saw a significant reduction in arterial blockages, right? So that obviously will lead to better health outcomes. And of course, Dr. Esselstyn's work with very critically ill cardiac patients saw significant improvement in their health outcomes as well, and a halt in the progression of their disease, which is the other thing that we need to consider here, is not even if you get regression of disease, the important thing is that you're stopping the progression, right? So there'll be no more cardiac events. So that is something to really pay attention to. Again, I've seen patients. I had one patient that you can find her interview on here, Rua. She stopped 3 blood pressure medications in 30 days, was one of my patients. Now, sometimes in some individuals, hypertension may take a little bit longer to decrease. Again, it just depends on the individual, but what we want to do is set the foundation for even the potential to reverse or at least improve your chronic disease. So understand that that absolutely can happen. So let me jump down to hypertension since we talked about that. So remember, hypertension is a silent killer, right? It's around the world, it can be, it causes heart failure, increased risk for heart disease, it increases risk for stroke, kidney disease, all these things from high blood pressure that you don't really have symptoms. You may have some individuals, especially if the blood pressure increases rapidly, some blood pressure, dizziness, blurry vision, but that's more rare. Typically, it's found incidentally. So when we talk to people about lowering the blood pressure, because they're not having symptoms, they seem to think of it's less of a deal. So like, oh, I take my medication, my blood pressure is better. But again, let's talk about that root cause that's occurring. How does a plant-based diet help lower blood pressure? First of all, plant-based diets are very rich in potassium, right? So this relaxes the blood vessels, helps lower the blood pressure. Typically, when you're eating a whole food plant-based diet, you're going to see a lower sodium, which again reduces the fluid retention, because remember, where sodium goes, water flows. So that's why when sometimes you eat a high salty meal, you might feel a little bit swollen and edematous. There was a meta-analysis that found that people on a plant-based diet had significantly lower blood pressure than those on an omnivorous diet. Again, the case I had with Rua, who I've interviewed on here, you guys can go listen to it, stopping 3 blood pressure medications in 30 days that she had been on for 20 years is pretty remarkable. But again, this is something to also take note of. I've had patients who engage in a whole food plant-based diet, but they have other people in the household that are on medication. So this is something that's very important. I'd like you to pay attention to. If you start a whole food plant-based diet and for yourself to reverse chronic disease, and the other people in the home are there to support you, they're eating the food with you, they're cooking meals with you, if they are on insulin or oral hypoglycemic medications or hypertension medications, please make them aware of the potential to need to drop medications very quickly. They need to pay attention to their blood sugars. They need to pay attention to their blood pressures. And if things start dropping, are they not feeling well, they're feeling dizzy, suddenly fatigued, low energy, they need to talk to the doctor about stopping or decreasing their medications. This is very, very serious. Again, plant-based diets are helpful for many other things. Let's talk about cancer. So some studies, not all, suggest that plant-based diets can definitely lower the risk of certain hormone responsive type of hormone type cancers, but like breast cancer, prostate cancer, but also those in the digestive system, right? Because if you think about colon cancer and those things, what does the colon and the intestines actually, they're exposed to food first, right? So all this fiber building the good healthy microbiome, and those little bugs, those little creatures are making stuff that are good for the environment of your colon, right? So you'll see a decreased risk of colon cancer because of those high levels of antioxidants, the fiber, and the phytochemicals. Such an amazing thing to start incorporating those into your diet and be thinking of all the things that you're also preventing beyond just the idea of reversing something, but what else are you preventing, right? The other thing is kidney disease. For those on a, if you have, it depends on the stage of kidney disease, but when you look at someone on kidney disease, you absolutely can see an improvement in the creatinine. But I think this is mostly because now you're eating a lower inflammatory diet, right? You're saying anti-inflammatory diet. So the inflammation decreases, and that's what you're seeing an improvement in. From my understanding of speaking to nephrologists, that you're not going to actually see a reversal of the scarring of the kidney, but you can definitely see a decrease in the inflammation, which will help bring down the creatinine and also improve your glomerular filtration rate, your GFR. And so there's some things there to pay attention to. The only thing I'd say is if you've been noted to have kidney disease and an elevated potassium, you might want to be very careful about as you approach a whole food plant-based diet, because you will be at higher risk of getting too much potassium, which again can cause its own problems. So you might want to make your doctor aware that, hey, I want to start eating more fruits and vegetables. Can we be monitoring my potassium? And I would say you probably want to monitor that at least every week or so, because you may need to be taking medications to decrease the potassium, or just slowly introduce the foods and just monitor and see how you do. Again, all that should be under the care and supervision of a physician who has some experience with this type of diet, or at least aware that eating certain foods will potentially have a dramatic improvement, and just some things to watch for. So I know that was a lot, but just wanted to highlight you absolutely can start this diet and do it very well. You'll see benefit. Now there'll be different stages of benefits. I would say you're going to see some people do better faster, and I really want to, this is an important point here, is that some patients get really frustrated because maybe they don't see the reversal of their type 2 diabetes that they saw their neighbor or maybe someone on an online support group had. I don't want you to get discouraged. They're on their own journey. They have a different body. They have a different clinical severity of disease. Maybe they've had type 2 diabetes differently. Maybe they're actually, much more aggressive on how conform to the diet that they're doing. Again, some people are like, well, I eat more plants. Why aren't I seeing a difference? Well, the more you embrace this and the more 100% committed you are in eating this more of the time, if you only do it 50% of the time, well, don't expect the 100% to see the benefits, right? So fully engage in the diet. And granted, you may need to ease into it, but you need to do it. And I'm all about meeting people where they're at and understanding that some people are going to struggle more than others. There's relationships with food, but at the end of the day, the most successful patients I've had are those ones who just embrace it and get it done within a period of sometimes overnight, but definitely within 2 to 3 weeks, that they're fully embracing the diet with the understanding that it's a journey and it'll be up and down, right? And so, but you can't just keep doing what you're doing and expect things to get better. It's just not how it works. That's just the reality. And so, all right. I hope you found that helpful. All right, guys. So I will leave that to you guys. And please subscribe if you're not subscribed already. And also, please share this with someone that you think might benefit. Love to hear your stories, your questions. Put them in the comments below. Sign up for my newsletter. I send out stuff like this every single week, and I'm happy to have you in the community. As always, I'm sending you gratitude, joy, love, and peace, and healing, because we all need more of that, don't we? Be it emotional, physical, mental, I don't know, spiritual. I just hope you find what you're looking for, because yeah, that's where I hope and love. That's all we need. All right, guys, take care and have a beautiful weekend, and stay safe out there, and please go eat some more vegetables. All right, guys, have a good day.